All right, so we're going to talk about potpourri of different devices. The first one I'm going to talk about is the Cardioband device for tricuspid regurgitation. And as you can see here, it's an incomplete ring that goes around the annulus that then is anchored down by multiple different points and then allows you to tighten it all up. It's the same system for the mitral and or very similar system for mitral and tricuspid. So for those of you like us that have experience on the mitral side, it was easy to learn on the tricuspid. It goes transfemorally. The key parts is that where you initially start anchoring down the implant, and then you can work your way around the annulus. And then finally at the end, then you cinch it all in to bring the annulus downsized. So we're in an early feasibility study right now, and that's what I'll tell you a little bit about as we finish our first 15 patients. Here's the inclusion-exclusion criteria, as you would expect for most tricuspid studies. And here are the list of the different sites involved in this EFS. We've now done 15 patients, and we have 30-day follow-up on all 15 of those. We're starting enrollment of a second round of 15. So but for these initial 15 patients, their demographics are as you would expect for patients with TR and some degree of RB dysfunction. Despite that, for this procedure, the safety profile has looked really good. There's no mortalities, no MIs, no strokes. There was one, as was mentioned at the previous session, right coronary artery kinking or constriction as the band was downsized. We do angiograms of the RCA, and the site noticed a significant, what they thought was significant kinking, and they decided to go ahead and perform PCI, which happened uneventfully. There was some severe bleeding issues, interesting enough, mainly from the contralateral leg where the 5 or 6 French femoral artery catheter was. I think that also speaks to these patients have some amount of hepatic dysfunction. So the technical success, being able to implant the band, was achieved in 14 of 15 patients. There was one patient that had partial dehiscence where a couple of the anchors did not hold. They were still able to place the rest of the band, just didn't tighten down. So the patient didn't have a complication per se, but didn't have a successful implant. The annulus in all the patients then that had a successful implant was successfully reduced, and that reduction in implant size of the annulus was sustained out to 30 days. And in the results on the TR, as you can see here, was about a 40% reduction by EROA, similar so in terms of vena contracta. So was a significant downsizing of the degree of their TR, but not elimination of it. That translated to significant symptomatic improvements, NYHA class or Kansas City cardiomyopathy questionnaire numbers, because more than 5 points is significant individual improvement. But interesting enough, there was not in this small series change in their 6-minute walk times. So I think really this speaks to overall safety in this early study, early feasibility study, and some degree of efficacy, and we are on a steep learning curve to figure out who to use this in and how to use it. Thank you.